Hello, nurses of Ghana. It's Earl Dalton. I'm the Chief Nurse Officer here at Health Carousel. And what an incredible honor it is for me to be able to come and talk to you today, all the way from Ohio in the United States, to talk about the African Oxygen event. Years ago, I met Mark and Bonnie Barnes, who, as you know, are the founders of the Daisy Foundation. And here in Health Carousel, we were just so inspired by the work that the Daisy Foundation was doing in the recognition of nurses, not only within the United States, but around the world. You know, the Daisy Award for me symbolizes dedication to our profession, professionalism, incredible acts of caring and compassion. And boy, I'm sure if I got a chance to talk to the winners of the Daisy Award that are present today, I would hear themes of these sorts of things just raining through in the stories that the nurses would tell us. You know, in all of my time, we've given out over 100 Daisy Awards here at Health Carousel. And every single Daisy Award winner, one statement almost reigns supreme every time when I talk to the winners. And they say to me, Earl, I was just doing my job. And that humility, that place where we're just doing what we're supposed to do in the time that we're given with the patient, just rings through over and over again. So, nurses, I have no doubt that today you're humbled by the award. I'm sure that there are hundreds of nurses who do what you do and would just say, "Hey, listen, I'm just doing my job." But you join the ranks of an incredible brethren, those who have won the Daisy Award. As Bonnie points out in her part of this discussion, over 5,000 hospitals are giving out the Daisy Award. They've been doing this over 2 decades now, and have given out over 200,000 nurse recognition moments with the Daisy Award. And so, what an incredible gift Mark and Bonnie Barnes are to the healthcare community, and the Daisy continues to live and shine bright. And so what an honor it is for us to be part of this celebration, making sure that nurses get this fantastic award on behalf of the Daisy Foundation today. You know, as I think about the future of healthcare, certainly as it applies to Africa, really I think you could make this argument for around the world. I think there probably isn't a bigger problem, a bigger challenge to overcome for our future than it does relate to staffing levels. Nursing is a reducing profession. There are less of us now than there used to be. In the future, there will be less of us again. And so as I think about future challenges of nursing in Africa, and certainly in the Ghana region, what I think about are really a couple of things. One, what is the pipeline with your nursing schools, with those that are coming up, maybe emigrating to your country or moving around your country? How are we taking care of the supply of nurses into the future? What an incredible question to answer. If you come up to the answers for that, please go ahead and share it with me, because this is a major problem really for around the world. You know, one of the stats that's bandied about is that there are about 30 million nurses in the entire world. By 2030, we'll be short by half around the world the number of nurses that we need. Leaving us with about somewhere around a 15 million nurse shortfall. So along with procuring a pipeline into the future of nursing, I think this is priority one. We all know that care transacts through the hands of a nurse. Every delivery system around the world, nursing is the centerpiece for a reason. And so we are care in action. So step one, I think, for the future, one of the big challenges that people have to overcome is securing your pipeline. Where are your nurses coming from, and how are you dispersing them around the regions of your country to provide the most care? I think what joins in that, right behind that, it's also the burnout and the mental health of our nurses. Nursing is a hard profession. And anybody who's practiced knows, we give so much to our patients. We have such concern for our patients over time. It's hard. It's hard to keep up with all of the care demands, all of the latest science to be able to provide the very best to our patients. So I think a lot about burnout. And I guess I would challenge the group there today as you think about future challenges within the country. What are you all doing to take care of the caregivers? Because, boy, as we shrink in population and size around the world, as nursing gets smaller, it's going to become more important than ever that we take care of those who are doing this work. And so what are your strategies? How is it that we're taking care of one another and giving care for the caregivers so that burnout, care fatigue, moral distress related to care continues to be on the decline? This is a major problem, and certainly one I think that African nurses will have to deal with as we go forward, which is not that different than the rest of the world. This is a problem I think that we're dealing with all over the world. When I think about solutions to these sorts of problems, I think about a couple of things. First off, what is the mentorship program, the model of entering new nurses who would be novices to our craft, and then moving them up through a model to expert nursing? Right? People want to be successful. They want to succeed. They want to have the tools that they need to do your job well. And so what's in the toolkit for orientation? How are nurses entering into the schools to prepare them for what's ahead as they enter into the profession and actually go care for patients in Ghana? I think making sure that you have the right training and support of new nurses is a critical piece for the future, and something I would certainly recommend that leaders look in on. I think the other big innovation, the other big piece that people are missing around the world that might be really important is care for the leaders. Who will lead us into the future, and are those people okay? And so I would challenge you all with what are your mechanisms to recognize leaders, to check in on leaders? Right? It can be a tough job. It can be a lonely job to be in charge and have to lead people. And so what are the tactics and strategies that you're using there to make sure that that group of people are well taken care of and that they can lead effectively over the next 10 years, where we'll have some bumpy times. But you know what? As with all things, nursing is its own gift. Our reward is in the care of our patients and seeing their smiling faces, seeing them overcome tragedy and triumph into the future. And I have no doubt that Ghana is up for the task. And certainly we'll be watching with interest here in the United States as the decades continue to unfold. So take care. Thanks for letting us be part of this incredible event. I'm incredibly inspired and honored to be able to be part of this today. And certainly on behalf of the Daisy Foundation and here at Health Carousel, we just wish you the very best, and thanks for all that you do. Take care.